Hello, this is Dr. Dan Dowd with Genemind, bringing you another installment of a Genecept SNP Clip. In this installment, we'll discuss the BDNF gene, its clinical relevance, and how to interpret test results to best serve your patient. This presentation and the Genecept assay may include discussion of drugs that are not approved by the relevant regulatory authority, including the USA FDA, or the use of drugs not approved for specific indications, also known as off-label use. To assess the potential benefit and potential harm, prescribers should be familiar with the indications, precautions, and warnings of drugs used. Please consult the manufacturer's prescribing information. As some of you may already know, Genemind is a personalized medicine company that is bringing innovation to mental health care through genetic testing. The Genecept assay is our main service offering, and it is a comprehensive test developed in our clinical laboratory. It provides licensed and prescribing clinicians a tool to use based on their patient's own genetic information that may help guide personalized treatment selection for mental illness. SNP clips are broken down into 4 basic segments to provide an introduction to the physiological significance of the protein expressed by the gene, basic information about the polymorphism and gene, and finally, what the genotype can mean clinically to your patient based on some of the current evidence. In this SNP clip, we'll focus on how BDNF genotype may influence SSRI response as well as response to exercise. BDNF is a protein involved in the development and maintenance of the central nervous system, and the highest levels of BDNF are found in the hippocampus and prefrontal cortex. It is critical to neuronal survival, development, and differentiation, and promotes synaptic plasticity. This fluoroscopic image shows a rat retinal neuron that has been injected with BDNF and then monitored for 48 hours. Investigators noted considerable increases in dendritic branching in the injected neurons. BDNF is also involved in the modulation of several neurotransmitter systems, including the dopaminergic, serotonergic, cholinergic, and glutamatergic systems. BDNF is a 36 kilobase pair gene found on the short arm of chromosome 11. The protein expressed is a precursor protein which includes a signaling peptide and pro-BDNF region, which are cleaved to release the mature BDNF fragment. There is compelling evidence that the uncleaved pro-BDNF has distinctive receptor binding affinity, which opposes the action of mature BDNF. While BDNF has the ability to increase neuronal excitability and synaptic strength, pro-BDNF can reduce neuronal excitability, decrease synaptic efficiency, and facilitate synaptic depression. The Val66 MET polymorphism is an amino acid residue substitution from valine to methionine at codon 66 within this pro-region. Functional gene studies have shown that the Val66 MET polymorphism impacts the trafficking of BDNF protein and messenger RNA, ultimately leading to diminished activity-dependent release of BDNF. This activity-dependent release is diminished by approximately 18% with one MET allele and 29% with 2 MET alleles. This may explain why the BDNF Val66 MET polymorphism has an impact on neurocognition and development of psychiatric disorders. So how frequently are the MET polymorphisms found in the population? The allele frequency of the Val66 MET SNP differs quite dramatically across ethnicities. The table shown presents the genotype frequencies for individuals of European, African, and Asian descent. You'll notice the near absence of MET alleles in the African populations, whereas the MET alleles are most common among individuals of Asian descent. Given the reduction in activity-dependent secretion of BDNF and its breadth of impact on neurotransmitter systems and synaptic plasticity, several clinical phenotypes have been examined in relation to the BDNF Val66 MET polymorphism. Several animal and human studies have linked the MET allele to reduction in hippocampal volume. The hippocampus is associated primarily with memory, and impairments in both episodic and working memory have been demonstrated in carriers of the MET allele. In a meta-analysis, the BDNF Val66 MET polymorphism was linked to depression in males, but not females, and 2 other studies concluded that the MET allele was associated with increased odds of late-life depression, which is depression that arises at the age of 50 or older. There is also some evidence showing that MET allele carriers are at increased risk for depression symptoms associated with altered stress response. For example, the Hosang meta-analysis examined the relationship between BDNF genotype, life stress, and depression, and found that the Val66 MET polymorphism moderated the association between life, stress, and depression, such that carriers of the MET allele were at greater risk for depression in the context of stress. As interpreted by Genemine's Genecept assay, there are 2 clinical implications relevant to a patient's genotype at the BDNF Val66 MET polymorphism. The first is exercise, and the second is antidepressant response. We'll first talk about a study by Erickson and colleagues from 2013. We know in general that exercise increases the secretion of BDNF from skeletal muscles, and that BDNF may improve cognitive functioning. These authors were interested, however, in whether there is a differential cognitive response to exercise based on BDNF genotype. The study included 1,032 volunteers who provided self-report information about their daily exercise and were also genotyped and assessed on a number of cognitive performance tests. If you look at the figure to the right, you can see some interesting results regarding the interaction between BDNF and exercise on working memory performance. Specifically, at low levels of exercise, MET carriers' performance was significantly worse on a working memory task compared to Val-Val carriers, but at higher levels of exercise, this difference was eliminated. This suggests that MET allele carriers may have a significantly greater response to exercise in terms of improving cognition relative to Val-Val genotypes. Therefore, with Genecept assay test results, physical activity and exercise is flagged as a therapeutic option for BDNF MET allele carriers. The second clinical implication of the BDNF Val66 MET genotype focuses on antidepressant response. Cole and colleagues in 2015 aimed to examine whether BDNF genotype moderates response to different classes of antidepressant drugs among 345 Caucasian patients between the ages of 18 through 65 with a diagnosis of major depressive disorder. These patients were all prescribed either SSRI, SNRI, or tricyclic monotherapy, and then SSRIs were compared to SNRIs and tricyclic antidepressants. The graph shows the significantly disparate remission rates of MET carriers compared to Val-Val patients within the 2 treatment arms. The Val-Val patients, reflected by the blue bars, reported higher remission rates on SSRI monotherapy compared to the MET allele carriers. Val-Val patients had a larger chance of remission on SSRIs compared to MET carriers. Conversely, MET carriers had significantly higher remission rates on SNRI or tricyclic monotherapy. Therefore, in the Genecept assay test interpretation, there is information in the therapeutic implications section highlighting that Caucasian patients may differentially respond to antidepressant class based on their BDNF genotype. In summary, the BDNF Val66 MET polymorphism has been shown to have significant implications for brain development and functioning and may increase risk for neurocognitive and psychiatric impairment. We reviewed 2 studies which demonstrate the clinical utility of testing for variations within this BDNF SNP, one showing differential response to exercise for memory performance, and the second showing differential response to antidepressant medications based on genotype. We hope that newer studies will emerge examining whether BDNF moderates treatment across ethnicities, as there have been conflicting results when ethnicity is taken into account. As a reminder, any clinician with prescriptive authority may order the Genecept assay. There are 2 options for ordering the test kit to use with patients: through the Genemind homepage at www.genemind.com support@genemind.com or through the Genemind customer service line at 877-895-8658. Representatives are available Monday through Friday until 7 p.m. Eastern Standard Time. Thank you for your interest in Genemind and the Genecept assay. We hope this webinar was informative. Thank you.